Welcome back. This is the third part of our three-part video series entitled Test Question Construction for ISTE Committee Members. Here are a few tips in designing our test questions. Researchers have proven that the best way to test if your examinee does know what you're asking is to limit the choices to 4. The minimum number of choices is 3 and the maximum is 5. If you can make it a standard of 4 choices, then that would be best. However, an exception is when in the real world, there are only 3 stages or 3 entities. Do not invent a 4th one just to come up with 4 choices. We also avoid absolutes, such as always and never, since everything changes with time. What may be true now may not have been true a few decades ago or may not be true years from now. For example, when I was a resident, it was known that psoriasis was a purely skin disease. 5 years after my residency, psoriasis became recognized as a systemic condition. Also, your question should be formatted in such a way that there is only one acceptable answer. We avoid all of the above and none of the above, as these types of questions do not test whether the examinee does know the answer, and having these kinds of alternatives promote guess-making. None of the above does not even have the correct answer in them. So how will you know if the examinee does indeed know the correct answer? For choices such as A and B or A and C, as was mentioned in the previous video, answering A alone makes it partially correct and raises the question of whether the examinee deserves a partial point. For example, here the distractor D is not effective because it encourages guess-making, especially since the correct answer is only A. We improve on this question by changing D to another plausible alternative. Keep the choices or alternatives approximately the same length. In the past, testmanship has shown that the longest answer is usually the correct answer. A lot of examinees know this already. So to discourage this kind of thinking, we keep all of them of the same length. We would also like to discourage the thinking that the shortest answer could be the correct answer, like in this example. We also need to make sure that the alternatives or choices are worded in a similar way. Grammar and syntax in the stem and in both the stem and the choices should be in agreement. In this example, with the grammar of the stem and choices not in agreement, you will be able to exclude immediately choices A and C. Or here, combining the longest choice and the different choice, with choice B having 2 items versus the others which have only 1, the examinee will assume that choice B is the correct answer. To improve this question, we can add cataract to the item stem. Avoid using terms in the choices that relate to the stem and will give away the answer. Here we see scarlet fever and the answer being scarletiniform. We mentioned earlier that we want our distractors to be logical, plausible, and unpredictable. Lying about his age is not an appealing distractor. For plausible distractors, an example would be to put the medicines that are available in the Philippines. Putting a medicine that is not available in the Philippines is useless since that knowledge will not help our trainees who are expected to serve the Filipino people. Choices are alphabetically arranged. We do this now so that there is no way that the examinee will think that there is some kind of code in the answers, like all the answers are C or is there a pattern to the answer key, etc. We arrange the non-alphabetized distractors to an alphabetized one. We avoid cluing questions. Cluing is when the answer is found in another number in the exam or when you give away the answer in the STEM. This is an example of cluing. The answer to number 2 is in number 3. We also avoid cascading questions wherein the answer to the second question depends on the answer of the first question. When the examinee answers the first question incorrectly, then the second question will obviously be wrong already. You didn't even give the chance for the examinee to answer the second question correctly. You already doomed the examinee to surely get one wrong answer in the exam. For those with pictures, graphics, charts, tables, you put the directions above the graphic or text, like so. The examinee will process the text first, and in succession will see what the text was referring to. Put most of the words in the stem instead of the choices. If you do this, then you will definitely put the main idea of your item in the stem instead of the choices. In a way, this goes hand in hand with the very first principle that I showed in the previous video, which is to stick to one principal concept or fact. In this example, the question is why is proper sunlight exposure beneficial to many dermatoses of the skin? The question itself, without choices, can have all sorts of answers. And then we see in the choices that ultraviolet exposure is in all of them. So we can improve on this question by putting ultraviolet exposure in the stem. We avoid statement completion as much as possible. Sometimes it is allowed, but most of the time we avoid it because it can become a grammar or syntax issue. And part of designing is putting your choices in vertical arrangement. The hazard with horizontal arrangement is that our brain is wired to process the data better in a vertical arrangement. As a review, when designing your questions, remember to limit your choices to 4. Make sure your choices are of the same length and wording. Make sure your distractors are logical, plausible, and appealing. Arrange your choices alphabetically. Put your main idea in the stem and not in the choices. Put the directions above the picture, graphic, or chart if you will be using those. Put the choices in vertical arrangement. And avoid these, all of the above, none of the above, always, never, cluing, or cascading. We have other things to remember, which are mostly content issues. These usually happen when we do not have or when we do not follow a test blueprint. So again, let me say that creating a test blueprint will help you create good test items and avoid the pitfalls. Here we have 2 questions on the same issue and the C's. While there are no construction issues, if we are dealing with an exam whose coverage is 100 chapters, it is a waste of 1 item if you will be using 2 test items on just 1 topic or content. The examinee will come out of the exam thinking that they had to read 1,000 pages and the exam then ask more pertinent questions. Or asking the least common instead of the more pertinent, most common. Unless, of course, the situation is unique in that the least is more important than the most, which is rare. This is one way of improving on that question. Or asking questions that are best asked using a graphic. Doing so will avoid plain memorization. Besides, will asking a question this way determine if the examinee knows what long strands of basophilic cells with fibrostroma look like. Since we would like our trainees to have critical thinking skills, we need to create more questions on the HOTS category. How do we do this? We may create questions that are case-based, questions that ask the examinee to interpret facts, to evaluate situations, to explain cause and effect, make inferences, and predict results. Clinical vignettes are preferred. And since we do a lot of online exams now, we can make use of visuals such as photos, graphs, and charts. In the past, we were limited by the printer. Issues of wrong color or expense would come up. We do not have those issues now with online exams. For case-based questions, remember problem representation using your 3 Ws. Who, what, when. Who is the patient? Give the profile like a 54-year-old male. What is the problem? Be specific. 50 or 54-year-old male came in for chest pain. When did the problem start? 54-year-old male came in for chest pain of few minutes duration. Also, we usually find a lot of questions on diagnosis, diagnostic tests, and treatment. We suggest that you explore asking questions on prognosis, landmark studies if this is applicable. In summary, these are all the principles and issues that we discussed in parts 2 and 3 of the 3-part video lecture series. This ends our video lecture series. Please do not forget that each of you will need to submit learning objectives, test blueprint, and 5 multiple choice questions. Deadline is on May 15. Kindly attach these documents to the Google folder that will be sent to your emails. Thank you.